Good afternoon, everybody. And I think we are just a few days away from approaching the Women's Day. So, welcome to the third series. Yesterday, we spoke about the lifestyle based gynecological issues, and then it was about teenage health. And today's topic is, I think, much more significant and relevant for all the women out there. This is Sharanya Shastri, a nutrition and diet consultant at Apollo Spectra, Bangalore. So I hold my master's in clinical nutrition with a special interest in sports nutrition and women health. And we have our esteemed panelists today with us who are specialized in different sectors of breast health with respect to women. So I would just like to introduce the panelists to all of you. We have with us Dr. Anjali Patil. Dr. Anjali Patil is a surgical oncologist and a general surgeon with over 30 years of experience and a pioneer in laparoscopic oncosurgery with expertise in open surgeries, robotic surgeries, and minimally invasive surgeries. Welcome you onto this panel, Dr. Anjali.
Thank you.
Second up, we have Dr. Asha Reddy. Ma'am is a very young and a dynamic oncoplastic surgeon practicing at Apollo Spectra Hospitals, Chennai. So she's completed her MS General Surgery, MCH, Oncoplastic Breast Surgery, and Fellowship on Breast Oncology from Tata Memorial Hospital, Mumbai. It's very nice to have you here, ma'am. Welcome on board. And then we have Dr. Rajinder Kaur Saggu. Dr. Rajinder Kaur has an overall experience of 18 years as a surgeon and 13 years of rich professional expertise as a surgical oncologist. Ma'am holds her expertise in breast cancer and non-cancerous conditions of the breast. She has wide experience in performing all types of breast surgeries, and she's found herself drawn to patients with breast problems, especially breast cancer. So it's very nice to have you here, ma'am. Welcome. And then we have our Dr. Nanda Rajaneesh, who's an eminent surgeon endowed with rich and diverse experience and distinguished academic record, has established herself as a specialist in breast surgery, minimal invasive gastrointestinal surgery, and surgical oncology. Ma'am has many feathers in her cap. She's trained in GI surgical oncology from the prestigious Tata Memorial Institute, Mumbai, and Heidelberg University Hospital. She specializes in bariatric surgery and all kinds of minimally invasive and laparoscopic surgeries for GI and rectal region. It's very nice to have all of you here, and welcome to all the panelists.
Thank you, Sharon.
Yes, I think without much delay, I would just start off with the questions. So there are, when it comes to breast health, I think earlier women would not even talk about it, and even now people hesitate, especially when it is in the rural areas. And also there's a lot of social media influence that gives us all wrong. Most of the times it's wrong and it confuses us. So I think it's very important to hear out what exactly should be done and what are the things that are really relevant from our expert panelists. So, my first question will be to Dr. Asha. So, how to do a self breast examination and when to do it? So, I think if you can throw some light on this, that will be really great.
Sure. So to start off with, I think self-breast examination is very important because it allows you to pick up any symptom of the disease if there's a disease early. So how to do a self-breast exam and when to do a self-breast exam. So self-breast examination, if you're still having your periods, should be done about 5 days after your periods. If you're postmenopausal and you don't have your periods happening, then you can pick one day of the month where you can do it. So this is when you should do it. The timing after the periods is because that's when the breast is most supple. So many people feel that before your periods you can feel a heaviness and a denseness, which reduces after the period. Now, how to do it? Let's first understand the aim of the self-breast exam. So the self-breast exam is to understand how your breast feels normally. So where is it dense? How does it feel? So that in the future, if anything develops, any kind of symptom, you'll be able to pick it up early. So how to do it? We recommend that you can do it either in a lying down position or standing position. So you can do it after your shower, just when you're having a shower, just put soap and water. And then if this is your breast, you feel with the flat of your hand. So in a rotatory motion, you feel the entire breast, looking to and understand and see how your breast normally feels. So never feel it like this. If you feel it like this, then everything feels like a lump. So you want to use the flat of your hand and use a rotatory motion to understand how your breast feels. And in case there's any nipple discharge, or you feel any lump, or you see any skin changes, you want to take that to the attention of your doctor. You also want to examine the armpit area, because sometimes if there's any disease in the breast or a breast cancer, it can present with a lump in the armpit area. So you also want to examine that area as well. So this is how you do a self-breast examination. So first, look at yourself. So you look at yourself in the mirror to see how your breast looks. If there's any redness, any skin changes, or any dimpling of the nipple, or any retraction of the nipple, or dimpling in the skin, those are all things to watch out for. And after you look at yourself, the way you do a self-breast examination is by palpating in this manner.
Thank you, ma'am. I think that is very useful. Everybody should know this. It's the first thing I think that every girl or every woman should be aware of. My next question is to Dr. Rajinder. So, ma'am, what are the risk factors that cause breast cancer? I think we would really like to hear that from you.
Actually, there is no definite cause for breast cancer, but it is caused by a multiple combination of many risk factors. The risk factors in breast are usually divided into two types. One is the modifiable risk factors, which we can change and reduce our risk. And the second one are non modifiable risk factors, which we cannot change and we are born with it. Some of the non modifiable risk factors are being a woman, advancing age, and then having a family history of breast or ovarian cancer, a genetic mutation, or having a personal history of breast cancer, or having a dense breast. So these are the non-modifiable risk factors which we cannot change. But there are few modifiable risk factors which we can change and reduce our risk, and they are right like uh, increase in weight, especially after menopause, if we can take care of that. Second is doing regular exercises reduces the risk, reducing the alcohol consumption, and having early childbirth before the age of 30, and breastfeeding your child for almost over a year, and reducing taking the hormone replacement therapy for a longer duration of time, and taking oral contraceptive pills for a longer duration of time. These are few of the risk factors which we can reduce and overall reduce the risk of breast cancer. But overall, having a risk factor doesn't mean that a woman will have breast cancer. It is and having no risk factor also doesn't mean that you will never get breast cancer. So it is just you have to be aware, because breast cancer is one of the most curable cancer, and if we detect it early, take care of ourselves, and it is the most and treat it properly, it is the most curable thing. Thank you.
Thank you, ma'am. Am I audible?
Yes.
Yes, thank you, ma'am. That was a very nice input. So, I think my next question is to Dr. Anjali. What are the lifestyle modifications to reduce these breast cancer risks?
So now that we know what the risk factors are, obviously that's already a lot of points have been covered. But nowadays, I see a lot of young girls, especially in the IT sector, smoking, taking alcohol. So smoking and alcohol definitely increase the risk of breast cancer. So I think that is one of the things that young girls should be aware of, and young women should avoid smoking, avoid alcohol. You see a lot of social media that alcohol is good for you, and there is peer pressure. Plus nutrition is important also. There is some amount of, like some things that you cannot avoid, like pesticides in food in India. It's so ubiquitous. And but yes, maybe we can try to avoid adulterated food, preservatives, colors, artificial sweeteners, and of course, like it was mentioned earlier, diet and exercise and weight management is extremely important in your lifestyle. So a lot of people feel that, no, I don't do this, I don't do that, I don't smoke, why did I get breast cancer? I don't have a family history of breast cancer, why did I get it? So nowadays obesity has become a very important cause of breast cancer. And another thing, with this social media, I must point out one fact that people are sitting for long hours watching Netflix, watching something on their WhatsApp, and they sleep so late. There is lack of sleep. They say that no, I have not, I don't get sleep, so I'm awake. So you have to, plus with your work schedule, sometimes you don't get enough sleep. So stress and sleep management is equally important. We need to take care of our stress, and stress cannot be from outside. This stress management comes from within. So you can go in for things like yoga, meditation, music, dancing, new hobbies, whatever you might feel would reduce your stress. And this can happen only within yourself. And of course, though we say that there are some modifiable stress I mean risk factors like genetics, we can definitely go in for some kind of a genetic counseling, and if necessary undergo some prophylactic surgery or screening procedures for the same. Thank you.
Thank you. I think that was very relevant and a very practical answer. I think all of us should really engage ourselves in some or the other lifestyle based, activity. So thank you, ma'am. And again, I'll just get back to Dr. I think is Dr. Nanda here, ma'am? Yes.
Yeah, yeah,
Yes.
hi, hi.
Yeah. Hi.
Sorry,
So, ma'am,
I missed
no
the
problem.
question.
So, ma'am, the question to you is, what is the significance of this breast anatomy and physiology causing breast disease and cancer?
Yeah, so what happens? I have written a book called Risk Factors in Breast Cancer. The first sentence that I write, being a woman, you can get breast cancer because it's a volume of breast cells decide. Just to give you a little brief about what is anatomy. So, breast has got a glandular tissue and a fat tissue. So, glandular tissue is responsible for being very active throughout the fertility period, that is till menopause, and there is a continuous proliferation and proliferation and differentiation taking place. So, during this period, any abnormality in the hormones can influence these cells and can lead to cyst and nodule formation and swellings. Uh, Now, just don't disturb me. Just I'll come back. I'll come back. Just go. Uh, uh, s- uh, so the during the proliferation and differentiation, the cells can become abnormal, especially in the proliferation time. So if they become abnormal during proliferation phase, they grow very fast. And in a young teenagers, the proliferation is very very high. Second problem with the breast is breast has a lot of fat content. More you put on weight, more fat accumulates within the breast, in between the glandular tissue. The fat is known to attract toxins. We all know that fat attracts all the toxins, and fat cells are known to produce estrogen like factors and which can influence the normal cellular growth and differentiation and proliferation. We all know estrogen hyperestrogenism is not good. So when fat cells are producing fat like estrogen like factors, that can also affect the breast tissue. And another thing that we should know is any fat in the body, especially more fat in the breast tissue, can attract infections. That's why nowadays breast infections and glandular infections are also becoming common. Duct motility is very very important. So a lot of patients, when they come with a discharge in the breast, they ask me a question: why did I develop breast infection? Why do I have pus in the breast? See, normally any organism enters the breast, it has to be expelled. So with the hormonal imbalance and and the abnormal organism coming and collecting in the breast tissue, it doesn't get expelled. So starts producing acute mastitis. And third thing is, you must have heard a very common condition called granulomatous mastitis. Autoimmune diseases are affecting the breast glands also. Normally, autoimmune diseases affect any glandular tissue in the body, so it can affect the breast also. So this is how anatomy and physiology of the breast play a big role in causing diseases to the breast.
Right, correct, ma'am. Thank you. Thank you for that input. So my next question is to Dr. Asha. So how important is it to get the screening done, and at what age should it be done, and what are the modalities of this?
So I think as we've discussed, the main aim of breast cancer is to detect it early, because if we detect it early, then the treatment required becomes less, and the cure rate is much higher when we detect it early. So how do we detect it early? When we discussed one thing we discussed was the self breast examination. The second is screening. So screening is basically any test that you do before you find a symptom. So before you feel a lump or before you find any symptom in the breast, doing it is what is screening. So how do we screen? As such, we don't have a set protocol in India, but what we generally follow is above the age of 40 to 45, getting a mammogram done every year. And sometimes, if your doctor recommends once in 2 years is enough, then you can get it done once in 2 years. So, a mammogram is done for screening above the age of 45, and this helps us detect early stages of breast cancer, which then helps us um, have a very good cure rate and minimize the amount of treatment that's necessary. When there's a family history of breast cancer and possibly some genetic changes, we start the screening a little bit earlier, and we also use an ultrasound of the breast. But I think generally what we should remember is anybody above the age of 40 should go in for a screening mammogram.
Right. Thank you, ma'am. I think that was very apt and a very important message for all the women who are watching this out there. So, my next question is to Dr. Rajinder. So, ma'am, can men also get breast cancer?
Yes, actually, breast cancer is a disease of women because they have breast organ, so it's very common in women. But it can also happen in 1% of men. Men also have breast tissue which is just beneath the nipple and areola in the central quadrant, and usually men present with the symptom of breast cancer like a painless lump in the retroareolar region, or they can present with a nipple discharge or nipple retraction sometimes, or there can be sometimes thickening of the skin of the breast. And usually the type of breast cancer in men, 90% of the cases it is invasive ductal cancer, and they are usually hormone responsive, ERPR positive. And the diagnosis of male breast cancer is also done by, you can do a mammography in men also, you can do an ultrasound of the breast, and the definite diagnosis is made by a core biopsy of the lump. And I also want to emphasize here that the treatment of male breast cancer is almost similar to the female breast cancer. The local regional treatment includes the surgery and radiation therapy depending on the stage of the disease, and the systemic treatment will include chemotherapy or hormonal therapy or targeted therapy depending on the IHC markers. And usually in men, the disease, this happens after 50 years of age. It's a rare disease, rare tumor in men, but it is becoming, the incidence as it has started increasing now. Thank you.
Right. I think that was a good thing. I think you really clarified it that it's not just with the women. So, thank you, ma'am. That was very, very informative. Uh, my next question is to Dr. Anjali. So, why is counseling important in the treatment of this breast cancer?
See, when patients, when any cancer for that matter, when you are diagnosed with cancer, there is a lot of fear in the patient's mind. And it is important to take this fear is regarding their survival, whether they are going to live long enough. There is fear regarding the chemotherapy, its side effects. There is fear regarding whether they would be able to work, whether they would be able to do their normal activities, how long the treatment is going to go on. And because of these fears, if they are not addressed, the patient is unlikely to be willing to take the treatment very well. So, this counseling is very important. It goes a long way in making the patient be cooperative and to get a positive result from the patient. And this it helps to develop a positive attitude in the patient. A positive attitude is important. There are a lot of factors. There's a lot of distress in the patient, the psychological distress, the body image also has a lot to do with when you are diagnosed with breast cancer, especially in young girls. So this counseling definitely does help. And of course, you have to counsel them that you need not lose your breast. Nowadays, the treatments are so much advanced. Where chemotherapy is concerned, they are scared about the loss of hair. So you have to tell them that no, the hair is going to come back, or maybe we have newer methods of treatment, targeted therapies, and in certain cases you may not even require chemotherapy. So all this counseling is important. Genetic counseling, if there is a family history of breast cancer, and or if it is in a very young age, or in certain other conditions, you have to counsel them regarding the genetic testing, or going to a genetic counselor. Pain management, and all these factors become very important. Another important factor about counseling is about that has become relevant today is about alternative therapies. A lot of patients are thinking about alternative therapies because of their fears of breast cancer. So you have to convince them that evidence based medicine is very important. At the same time, if they wish to have some kind of alternative therapies which may definitely help them in their stress management, anxiety, nausea, vomiting, and pain management, so all these things have to be explained by a good counselor. So I think that's important.
Yes, I think that's correct, and thank you, ma'am. So, in continuation with that, my next question is to Dr. Nanda. So, ma'am, are you there? Yes. So, breast cancer's treatment, like in continuation with what Dr. Anjali said, is it possible to do it without chemotherapy and radiotherapy?
Yeah, when we treat early breast cancers, because we stage clinically early breast cancer, locally advanced breast cancer, metastatic breast cancer. This is a clinical staging of the breast cancers. So when we only in early breast cancer, it is possible that we don't have to give chemotherapy. So sometimes we also do a special test called oncotype TX, just to decide whether it comes in the low risk or high risk. So whenever patient is in low risk, we don't have to give chemotherapy. We can avoid chemotherapy. But when we do a breast conservation surgery, because I retain the breast, I need to protect that breast again from the cancer coming back again. That's the reason radiotherapy has to be given if I'm doing a if I'm preserving the breast. But if I do a mastectomy for early breast cancer, very rarely we do it nowadays, because if a woman is coming from a village and she doesn't want to repeatedly, she doesn't have a good chance of coming for repeated follow-ups. That time, if we do a mastectomy for early breast cancer, if the node is negative, we don't have to give radiotherapy also for these patients. But you must remember regular health checkup, pickup of the cancer at an early stage can avoid chemotherapy, because chemotherapy is one everybody is scared of, and it is also cost is very high. Chemotherapy cost can be more than even the surgical cost. So because in our country, because insurance is not covered for everybody, cost is a huge issue once they have a cancers. So this is a reason you have to come for regular screening to detect it in early stage so that you can avoid chemotherapy.
Right. Thank you, ma'am. That was very informative. So, again, coming back to Dr. Asha. So, why do we really need a biopsy, and does the disease spread if you get a biopsy done? I think this is everybody's, I think most of the viewers would like to know about this. Ma'am, you're not audible to me.
Sorry. I think this is a common myth, and we're not sure from where people have got this knowledge. But somehow, whenever a patient comes with a breast lump and we do a mammogram, and the next thing we tell them is that they need a biopsy, the first question is, "Oh no, I don't want the biopsy. It's going to cause the tumor to spread." And we hear this a lot. But we need to understand that doing a biopsy in a breast tumor is not going to spread the disease. And in fact, it is very necessary to plan the next steps of treatment. So, just because you found a lump, you cannot go and just remove the lump and then see what it is and decide the treatment further. You have to get a biopsy done, figure out what the disease is, and then there are a few more tests called hormone markers, which we do on the test, which will help decide the further course of treatment. So it is part of the diagnostic workup, and it does not cause spread of the tumor.
Okay. Thank you. I think thank you for bursting that myth. It's very important for all of us to know and get that screening done. So my next question is to Dr. Rajinder. So, ma'am, what are the facts about breast cancer that a woman should know in general?
Yeah, some of the facts about breast cancer in Indian context, I'll say that breast cancer is now the number one cancer in women, and it has surpassed the cervical cancer. And the incidence of breast cancer is increasing rapidly. And every year in India, we get almost more than 1,80,000 new cases of breast cancer. And out of them, almost 50% of those women lose their life to breast cancer. You can say that 90,000 women die because of this disease. And in India we have more younger population, and we have more younger women diagnosed with this disease almost 10 decade earlier as compared to the western counterpart. And because of the younger population, the diagnosis becomes difficult because they miss it with some fibroadenomas or some with breast cysts or normal breast tissue. And the disease also in younger women is more aggressive, and the prognosis is overall bad. And in India also we have women presenting, more than 50 to 60% of women presenting to us in a more advanced, locally advanced breast cancer, where overall prognosis is also bad. And then in India we have more population, more women who are in urban cities. They have higher incidence of breast cancer. That may be probably because of westernization of lifestyle. And it is seen that statistics shows that 1 in 22 women in urban India and 1 in 60 women in rural India are get breast cancer. And so the point is early detection, more screening, because it helps in improving the overall prognosis. And because it is one of the most curable disease, which everyone should be aware of the signs and symptoms, so that we can take care of and reduce the incidence and the death rates in India at least. Thank you.
Right. Thank you, ma'am. It's very important to, I think, emphasize on the fact that it's curable and people should be aware of this. So, my next question is to Dr. Anjali. So, ma'am, is breast cancer hereditary?
Uh, Not all breast cancers are hereditary, but yes, say 1 in 20 of the women who have breast cancer would be having a hereditary breast cancer. So, in which patients would you expect is that, especially in patients who have an early, when would you suspect that it's a hereditary breast cancers? When there is an early onset of breast cancer, especially before the age of 45 years. There is an increased incidence also in if the patient has got bilateral breast cancers or greater frequencies of multiple primary cancers. It is an autosomal dominant inheritance, and usually there are two type most important genes that are mapped for this genetic cause is the BRCA1, BRCA1, and BRCA2 genes. So in BRCA1, the breast cancer risk can go up to 83%, and it also results in increased incidence of ovarian and prostatic cancers. And in BRCA2, both male as well as females, that is men as well as women, have got an increased risk of breast cancer. So overall, in BRCA 1 and 2, the overall risk of developing breast cancer would be around 60 to 80%. Apart from that, there are other mutations also seen, like P53 mutations and certain syndromes in which it occurs, that is Lee-Froman syndrome, Cowden's disease, and these are a lot of other diseases also. What is important for these patients is you have to start, if there is, you have to do a good genetic counseling for the relatives who are the primary relatives of it is hereditary from the maternal side. So if the mother has, the mother's sister has, or the mother's side grandmother has breast cancer, then you are going to suspect a higher risk of having hereditary breast cancer. Then you would go in for a biannual checkup with doctor. When if it is a high risk, you can start with at as early as 20 years of age, but otherwise you can wait for if you want to do any prophylactic mastectomy, or you want to take any steps to prevent this breast cancer, then you can delay it up to the age of 35 years or till the patient completes a childbearing. Apart from mammography, you do MRI when you are doing for the BRCA positive patients. And if you suspect it in a younger child, you should be very careful in taking the biopsy, because I think Dr. Nanda had explained that the breast tissue is very, very sensitive, and you don't want to harm the developing breast bud. And if you have a tumor there, you might even excise it.
Thank you, ma'am. I think that was really very informative. And in continuation to that, so my next question is to Dr. Nanda. Ma'am, what is a breast cyst and why is it very common among the young girls?
Yeah, there are two reasons for it. One is endogenous hormonal imbalance and input of the exogenous hormones. So I will talk about exogenous hormones later. The what is endogenous hormones that are imbalanced? Now there is a huge nutritional imbalance. Raw material for hormone is antioxidants, multivitamin, micronutrients, and good nutrition also. So what is happening? People are eating burger, bread, cheese, ordered food, and Zomato because of this urbanization, the culture is changing for all the young girls now. And as it is, it was there even before it was common in young girls, because if you see pathophysiology of cells of the breast in an younger age group, one is there is high estrogen influence on the breast tissue, and there is a very high proliferation rate is very high in young girls than in little older age group, about 30-35. If you see, after pregnancy and pregnancy, the proliferation rate slightly comes down, but in nulliparous women, the proliferation is very, very high. So, because of the high proliferation, any irritation of the normal irritation of the cells due to hormonal imbalance, abnormal foods, the irritated cell can start multiplying. That is how it reacts. So, the multiplied cell will form a cyst or a nodules like fibroadenomas. But to call it cyst, the multiple cyst can happen, discharge from the nipple can happen. This is a very common condition. Other one, there is a huge correlation between autoimmune disease and breast discharge. Also, eating certain bad foods. What autoimmune disease that I'm talking about is antioxidant diet. Certain diets which produce toxins, and the toxins can produce irritation to the cells, and it can produce. And secondly, I was talking about exogenous hormones. What are these exogenous hormones? Now, cows are given injections, vasopressin injections, to produce more milk. The same milk contains vasopressin hormone, and the girl consumes it. Parents are actually continuously drink milk, drink milk. They're always keeping it on the table and telling forcing the girls to drink milk. But they don't know that it is having an indirectly a bad impact on the girls. So it is containing vasopressin hormone, which is supposed to stimulate cow's breast, is also stimulating this girl's breast, and that's why there is a hyperproliferation of the cells leading to cyst in the breast.
Thank you, ma'am. I think all of us should be aware of what we are eating and exactly we have to correct our nutrition and diet that we are following. So, my next question is to Dr. Asha. Do all people with breast cancer have to lose their breasts? I mean, that's one thing I think when people they really get a little worked up when they are diagnosed with breast cancer. So, is this like a norm? I mean, is this the part of the thing, or how does it work, ma'am?
So I think we've kind of discussed it briefly already. So again, the importance comes back to the stage of diagnosis, and it's not necessary that all patients with breast cancer have to remove the breast. So many patients, especially with early breast cancer, we can save the breast. Cosmetically, there's not much of a defect, and it's followed by radiation, like doctor was mentioning, and that's now become almost a standard protocol for early breast cancers and early stage breast cancers. So in advanced cancers, however, many times that we do have to remove the breast, and that's why again the emphasis is put on early diagnosis, screening, and finding the lesion and lump at a smaller size.
So, ma'am, so do you have you seen any patient in your practice? Like, if there's any case study or something that you've seen in your practice, if you could just, tell that it's not really necessary to lose your breast. Any,
So many
live
patients.
example or anything.
Yeah, so most patients, many patients, 1 centimeter, 2 centimeter lump, early stage one breast cancer, or patients who go for a routine checkup and find a lump or find some abnormality on the mammogram that we call calcifications. For all these patients, we generally only do a lumpectomy, which is removing the lump, and then which is called a breast conservation surgery, with a sentinel node biopsy, which is we just make sure to check that it hasn't spread to the lymph nodes. So for many patients now, the routine practice, I think for all of us, has become doing a breast conservation surgery and saving the breast.
Right. Thank you, ma'am. I think this is a very important message, or
Yeah,
women should
I think
know
that's
that.
another, yeah, it's a major fear that, prevents patients from coming to the doctors because I think they're very keen not to lose the breast. So, there's so many advances in medicine, and this is one of them surgically where, it is safe and there's enough evidence and proof to show us that we can save the breast in many cases. So I think this is a fear again that, people should not prevent themselves from coming to the doctor because they're scared they're going to lose the breast. And even in patients who do lose the breast, there's many forms of external prosthesis, many types of reconstruction that can be done. So there's a lot of options available surgically to help the cosmetic outcome of breast cancer. So it's nothing to fear, and I think that so many options are available should be known to everybody.
Right, right. Thank you, Dr. Asha. So my next question is to Dr. Rajinder. So, ma'am, what are the general symptoms of breast cancer that one must watch out?
Yes, the actually the early breast cancer has no symptoms at all. That is why, as Dr. Asha said, that screening mammogram is the best modality where we can pick up small microcalcification or stage 0 breast cancer or DCIS, which cannot be felt with the hands. However, the most common symptom with which a lady walks into the breast clinic is a painless breast lump, and most of the time this lump is painless, small in size, and it is usually confused with a fibroadenoma. And in 10% of the cases there can be a pain, so it should not be ignored. Any lump, whether it is painless or painful, should be evaluated by a triple assessment. Triple assessment means the clinical examination by a doctor, and secondly, imaging either by an mammogram, or if the lady is young, by an ultrasound or an MRI of the breast, and third, the definitive diagnosis is made by a core biopsy. And then the second symptom usually is a nipple discharge. And if the nipple discharge is happening from both the breast and from the multiple points, and it is milk in color, or it is like greenish in color, then there's nothing to worry. It can be because of hormonal changes or because of high prolactin levels. But if the nipple discharge is happening from a single breast, from a single point, from one duct, and it is reddish in color, or you can say it is completely clear white in color, and this symptom should not be ignored, and it should be evaluated with imagings or an ultrasound, and to look for any underlying retroareolar lump in the breast. And the third symptom, there can be a nipple retraction, a small lump inside, just beneath the nipple, can be pulling the nipple inside. It can also be a sign of breast cancer. And fourth, if a lady notices any sudden change in the size or shape of one breast, and there is skin changes over the breast, like puckering, like dimpling, or some redness over the breast, or some thickening of the skin, like an orange peel appearance, these are some few symptoms of the locally advanced disease. These should not be ignored. And sometimes there is nipple itching or irritation of one nipple, and sometimes nipple erodes and falls off. It can be a sign of Paget's disease of the nipple. So these are few of the signs and symptoms which should not be ignored. And anything which you notice new in the breast, doing breast self-examination, or just looking at yourself in the mirror, you should immediately report it to the doctor. It may be normal, because 80% of the changes happening in the breast are normal. Only 10 to 20% of the cases we find cancerous or precancerous changes in them. So not don't be worried, just evaluate yourself, go to a proper specialist, and make a definitive diagnosis, so you can be rest assured that this is not cancer. And even if it is cancer, it can be treated at a right time, with the right doctor and the right place, so that we can have a better prognosis.
Right. Thank you, ma'am. So, in continuation to what you said regarding fibroadenoma, my next question is to Dr. Nanda. So, ma'am, when to operate these fibroadenomas?
Normally, when patients are having fibroadenomas, they panic that it could be malignancy, but we don't operate all the fibroadenomas that we see clinically. So there is a definitive size we decide, that is mostly 3 centimeter in size. More than 3 centimeter size lumps we operate. So Let us say if she has 3 centimeter lump and there are multiple fibroadenomas, we don't have to remove other fibroadenomas. We can just remove one fibroadenoma, and nearing fibroadenomas is okay with that incision. And normally, whenever we operate on the breast, it is an oncoplastic surgery. Means we make sure we give a good scar, and we make sure the shape of the breast is maintained. So we must ensure these things are done also for the patients, because mostly fibroadenoma patients are young girls. For them, getting operated itself is a big thing. But I've also seen a lot of times they go on with lump in more than 3 centimeters. What happens when the size of the lump reaches 3 centimeters? The volume of cells are very high. Higher the volume of cells, faster it grows. So we have seen large fibroadenomas also they come up with. Instead, once they're 3 centimeters, better to get them removed.
Yes, yes, ma'am. Thank you. So my last question is to Dr. Anjali. So can you mention some of the breast conditions that women of different age groups should be aware of, because they're very vulnerable. And so what are the things that they should be aware of, right? From infancy to old age, and what are the treatments that can be given, and what are the things that should not be ignored?
So if we start from infancy, when sometimes newborn babies, you will see that they have a little bit of breast nodule there, and on expressing, you will get a little bit of milk also. It's also known as witch's milk, but really it is nothing abnormal. It is due to the mother's hormones that enter the baby's blood when the baby is inside the body. So this we do not need to treat it per se. It subsides on itself. Better not to irritate it by massaging it or pressing it much. The other things is that sometimes even in boys or girls you could have an early breast development, that is if it happens before 8 years of age, and that can also be like Dr. Nanda mentioned, due to adulterated milk with certain hormones, or there might be some products like cosmetics, hair creams. Sometimes the child might have consumed some kind of oral contraceptive pills. So all these can cause early breast development. You have some congenital anomalies that is happens from birth. These what you call as birth defects, not exactly a defect, but they are anomalies. So you might have multiple nipples, you might have multiple breasts, and there could be so this is known as polythelia, polymastia. Then you might have absence of breasts, that is amasia, and you might have absence of one breast. And all these things can of course be treated surgically. If you have only one breast, you can do an implantation or a plastic surgery in which you can make both the breasts appear normal. One must understand that normally also the breasts might be a little asymmetrical, so that need not exactly be a disease. The breasts need not be exactly of the same size. Then development of adolescence, that is development of the breasts during the puberty period. This is known as thelarchy. This normally occurs after the age of say 10 years or so, but it can happen a little earlier, like we said, due to exposure to estrogens, even psychological exposure, the way children are exposed to sexual content on in books, in media. So that could help in the early breast development. And then apart from that, you might have a delayed thelarchy, which happens if there is no breast development after 13 years, for which you might have to consult the doctor and see what if there is any other hormonal problem. In males, we have already mentioned that they could have a gynecomastia, which again could be due to hormonal imbalances or tumors everywhere elsewhere in the body. And like Dr. Nanda had explained, due to excessive fat deposition, because fat contains this enzyme leptin, which could result in formation of estrogens in the fat. And then fibrocystic disease has already been discussed. In specific diseases related to pregnancy and breastfeeding are mastitis, that is pain and inflammation in the breast, or breast abscesses, which require treatment. And as and breast cancers is seen more in the older age group. Of course, nowadays we are seeing them in the younger age group. So there are the conditions known as phyllodes tumor, which occur in the younger age group, which require which look like fibroadenomas, but yeah, would require a doctor's consultation for it, like in fibroadenoma. And these are the common ones I think people should know about, that not every lump in the breast is going to be cancer, but always important to check up with the doctor whether it is cancerous or not, irrespective of the fact whether it has pain, it is giving you trouble or not giving you trouble. Get it examined by your doctor. Thank you.
Thank you. Thank you very much, ma'am. I think with this, I would like to conclude the session. And I think the take home message is very simple: timely screening and not to panic. That's the biggest message, that because not everything, like Dr. Anjali said, is a cancer. So you have to just be aware and, get yourself screened, and with, of course, change in your diet, nutrition, and lifestyle. So do not fall prey to fancy diets and fancy content that comes on social media. It's important to talk to your doctors, well qualified dietitians and nutritionists, to get your lifestyle and diet and health in the good shape. So thank you for joining us. Thank you all the viewers. Thank you doctors for your time and for your expert inputs. And I would like to conclude. And for tomorrow, we are speaking about post menopausal women health. So please do join in. And thank you very much. Wishing you all a very happy Women's Day.
Thank you.
Thank you,
Thank you.
Sharanya.
Thank
Thank you.
you.